I'm going to be talking about fetal assessment, specifically McDonald's rule, which measures the height of the fundus, and the Leopold's maneuvers, which will tell us the fetus presentation and position. So with Leopold maneuvers, it will answer 3 questions for us. What fetal part is in the uterine fundus? Where is the fetal back located? And what is the presenting fetal part? With this maneuver, you want the woman lying on her back briefly, but you have to remember to put a towel or pillow under her left or right hip. This will prevent her from lying directly on her superior vena cava. So there are 4 different maneuvers with the Leopold maneuvers. For the first 3 maneuvers, you'll be facing the patient's head, and for the last maneuver, you'll be facing the patient's feet. So in picture A here, you will be identifying the fetal part that occupies the fundus, and this will tell us the fetal lie, if it's longitudinal or transverse, and the presentation of the fetus, whether it's cephalic or breech. And remember, we want cephalic, which means the head is facing down, and breech means the butt is facing down. So in picture B, we are going to be palpating for the fetal back. This will also help us identify the fetal position. And then picture C, this will help us to determine the attitude of the head, whether it's flexed or extended. And then in picture D, this is the maneuver where you're facing the patient's feet. You're going to use both hands and outline the fetal head. This will also help us identify the attitude of the head. So this is straight from the book, The Procedure of the Leopold Maneuvers. If you want to read through it, it's pretty detailed. But just to make sure the woman has voided before these maneuvers are performed, because if she has a full bladder, they will be uncomfortable. And also to reiterate, make sure a small rolled towel is under the woman's right or left hip. So for McDonald's rule, we'll be measuring the height of the fundus. And this is done 20 weeks and beyond. And the fundal height should be equal to the week's gestation, with a standard deviation of plus or minus 2, depending on the stature of the woman. And it's going to be measured from the symphysis pubis bone to the upper border of the fundus. And for this measurement, you also want to make sure the woman has voided, because if she has a full bladder, that could change the height of the fundus. This is just a picture from the slides and books, shows the measuring of the fundus and how to do that and what to look